Baird, and welcome to this community briefing on Lincoln and Lancaster County's pandemic response. Joining us once again to provide interpretation is Margie Prupp. Thank you so much, Margie. And thank you to all of you for tuning in to learn more about the latest local developments and how you can keep yourself and others safe. Our health department and community partners held a third mass vaccination clinic at Pinnacle Bank Arena last Friday. And we are so pleased that this event enabled us to successfully vaccinate over 4,800 Lancaster County residents, most of them aged 80 years and older. A friend of mine's mother was among them. My friend posted on Facebook about how her son had kindly offered to take his grandma down to the Haymarket that morning for the scheduled appointment. And while there, he snapped a photo that took my friend by surprise. The photo captured my friend's silver-haired mom and dad striding toward the big glass building, holding hands. Her dad had received his first vaccination at the VA the previous week, and my friend had just assumed that he would stay home. Instead, there they were together, side by side, in their white and blue parkas, helping each other avoid the icy patches on the sidewalk as they made their way to the front doors of the clinic. A picture of enduring love and care. I am grateful for the care that my friend's parents and so many of you have shown one another during this pandemic. Your care is seeing us through to brighter days. You have continued to wash your hands, watch your distance, wear masks, while avoiding crowded places and confined spaces and close contact, and it is making a difference. In fact, your care for each other and our community has helped move our local risk dial this week into the yellow for the first time since late August. Yellow means that the risk of COVID-19 spread is moderate. Think of yellow on the dial like yellow on a streetlight, signaling you to be cautious. We still need to be careful. We do not want that yellow to turn to red. We need to continue to practice the 3 W's and to avoid the 3 C's. But even so, this is just some of the best news that we've had to share with you in months. And Health Director Pat Lopez, in just a moment, will provide more details on the positive trends in our data that determine the dial position. In other good news, as of noon today, 38,703 doses of vaccine have been administered in Lancaster County. Of those, 27,455 individuals have received the first dose, and another 11,248 received their second. Nearly 72,000 people in our county have registered to get notified when it is their turn to receive a vaccine that in study after study has safely and effectively reduced the likelihood of illness and prevented hospitalizations and deaths. We encourage everyone to receive vaccine as soon as it's available to them, and our community's enthusiasm for the vaccine is yet another sign that we are making good progress along the pathway out of this pandemic. And we are on track to make even more good progress. Beginning this week, our health department is receiving a 25% increase in our allotment of vaccine from the state. With 4,875 doses headed our way for the next several weeks, we are thrilled to be hosting 2 more mass vaccination clinics at PVA this Friday and Saturday, by appointment, for residents ages 75 years and older. As we continue full steam ahead with our vaccination efforts, we encourage people who have not yet registered to do so, particularly if you are age 65 years and older. Register today by completing a simple form online at our website, covid19.lincoln.ne.gov, or by calling the Health Department hotline at 402-441-8006. You will be able to sign up for an email, text, or phone notification from the Health Department that lets you know when you become eligible for the vaccine. And once you are eligible, the Health Department will schedule your appointment. Here to share more about our local vaccination efforts, the risk dial, related changes to our directed health measure, and our community's overall progress is a person whose tireless efforts demonstrate her care for us all. Health Director Pat Lopez.
Thank you, Mayor. I'm going to start again with our efforts to provide the COVID-19 vaccine to residents of Lancaster County. As the Mayor mentioned, 38,703 doses of vaccine have been administered so far by our Health Department and our partners, Bryan Health, CHI Health St. Elizabeth, Lincoln Surgical Hospital, and Blue Stem Hill. as well as our long-term care facilities and some partner pharmacies who've been working alongside us. We are mostly finished giving the first doses to those in Phase 1A, and we are now giving second doses to that priority group. Last week, we began vaccinating those in Phase 1B, which includes people age 65 and older, those age 18 and older with underlying medical conditions, as well as those designated as essential workers. On Friday, we held our third clinic at Pinnacle Bank Arena, our first for those in Phase 1B. The clinic was open for our residents age 80 and older, as well as their spouses, and we vaccinated just over 4,800 people at that clinic. We saw a lot of smiles and positive energy at the clinic, and it was extremely rewarding to be able to vaccinate our residents in this age group. We know many older adults have given up precious time with family and friends to prevent illness, and the opportunity to receive a safe and effective vaccine gives all of us hope for the future. Community partners and volunteers have played a critical role in all three of our large-scale clinics. The arena staff have been extremely accommodating and have worked very closely with us to make these clinics safe and successful. Thank you to all our volunteers who assisted Friday, also including City Council members Tammy Ward and Richard McGinnis. We also had valuable assistance from other city agencies, including the police and fire departments, Lincoln Transportation and Utilities, and aging partners. In fact, our very own Randy drove the bus for people. Randy Jones is the director of Aging Partners, an agency that serves our older residents every day. He and several members of his team were at the Friday clinic, and he now joins us to tell us about his experience.
Thank you, Pat. It just seems natural that Aging Partners is an important part of helping the community get through the COVID event and begin to transition into more normal life. Aging Partners traditionally is here to support seniors be as independent as they can, mostly living in their homes if they're able to. During the pandemic, we've shifted our method of delivery and are providing meals delivered to homes to those seniors that depended on us for their meals during the noon hour. But we're also now delivering those meals and supplementing Tabitha's meals, supporting them in their home Meals on Wheels program. We've been doing outreach to seniors to make sure they're safe at home, make sure that they understand the opportunity here with vaccinations, been conducting health checks, and a new program that we started at the beginning of the COVID event, NeighborLink, has been linking volunteers with seniors who need their help. Working closely with the health department, we've had 20 staff that participated in last Friday's clinic, and we escorted people around the event. We assisted with wheelchairs. We had a chance to drive the bus and transport people to the site, and we'll continue to do that in the coming clinics. There's a lot of logistics that go into this kind of planning and a lot of different events that change, weather, traffic, but I'm very impressed with what we saw Friday, and I just know that lessons learned from Friday will make next event even stronger. I'm also encouraged to see the smiling faces of the seniors. I had a chance to talk with seniors at the scene, or at the site, and they were filled with hope about the opportunities that the vaccine gives them. Seniors have been faced with isolation, and many have been in their homes, in their apartments, for a year now. Some of them have not been able to hug family, to hug grandchildren, to be as active as they normally do. And this is why vaccinations are very important to seniors, not just for their health, but for their mental health as well, so that they're able to be more active, use their muscles more by getting exercise, being able to hug grandchildren, and make important medical visits so that they can remain healthy in the long term. We've learned a lot of lessons with the COVID event, And a lot of those lessons we will apply in the future. And one of those is the importance of friends, family, and people like our NeighborLink partners who are willing to help. No one can face these challenges simply alone. And we want to make sure that people living alone, seniors living alone, can rely on a friend or family or neighbor to support them. And we would encourage those relationships to be fostered now and also into the future. Perhaps there's some seniors that are living at home alone that need some help navigating the registration process for vaccines, or to be escorted down to the center when we're doing the clinic. We would encourage you to talk to those neighbors in need. Aging Partners really appreciates the opportunity to help, and we're going to be here strong in the future.
Thank you, Randy. Randy didn't mention either how much support his staff has provided to our department, and it's really been a valuable resource for us in working with our elders in the community, not only what they do with that, but working with our long-term care centers. So we're deeply grateful that we have this resource in our community. When I look at all our other health departments across the state, we're just really fortunate that we have this close partnership and this valuable resource for our elders. So thank you, Randy, and thank your team. The residents who were vaccinated on Friday will receive their second dose in a few weeks, and we will provide those vaccinations over 2 days to ensure appropriate distancing. We have been hearing both compliments and concerns about the clinics, and we value the feedback from our residents. After every clinic, we conduct a review and look at what was successful and identify any opportunities for improvement. We then adjust our operations for future clinics to make sure the vaccination process is as safe and smooth as possible. This week, our vaccine allocation increased from 3,900 doses to 4,875. We are working with our pharmacy partners to offer on-site vaccination to residents of our independent living communities. Also this week, we are planning 2 vaccination clinics for residents age 75 and older. These clinics will be Friday and Saturday at Pinnacle Bank Arena. Residents will need an appointment to receive vaccine at these clinics. And our health department team is now in the process of calling residents in that age group who have registered to receive vaccine. And we are scheduling them for appointments on Friday and Saturday. Spouses of those in this age group will also be eligible to receive the vaccine. There is no need to come early. In fact, we urge those with appointments to arrive at the arena as close to their scheduled appointment time as possible to prevent congestion. I want to stress that there will be enough vaccine for everyone who has an appointment to receive the vaccine. We also know it will be very cold this weekend, so clinic attendees need to dress warmly and wear masks. Of course, we will provide the same extra support and assistance for these clinics as we did last Friday to help ensure ease and accessibility for the population being served. A family member or caregiver is welcome to accompany the person receiving the vaccine through the process. Actually, I saw many family members taking pictures of their parent being vaccinated and asking for pictures to be taken together. Extra staff will be on hand to help those who may need additional assistance. The clinic will take place on 2 levels, and both are easily accessible. Wheelchairs will be available again, and if clinic participants have limited mobility, they are encouraged to bring their own wheelchairs or walkers if that's possible. Free parking is available in the garage attached to the west side of the arena, and those who park in that garage will not need to go outside to get to the vaccination site. We also provide, will also provide courtesy vehicles to transport people from the parking garage to the arena if needed. Brian has assisted us with that last week. On the horizon, we see the opportunities for vaccine distribution expanding. One of those is a federal retail pharmacy program for COVID-19 vaccination. The federal government is taking the lead on this program and is collaborating with states, national pharmacy partners, and independent pharmacy networks. The goal is to increase COVID-19 vaccinations across the country, and it's rolling out incrementally based on the available vaccine supply with select retail pharmacies who are providing vaccine to those who are eligible. The program will roll out in Nebraska this week and possibly next at certain pharmacies will have the vaccine available. We will be working closely with participating pharmacies in our community, and details are still forthcoming. The participating pharmacies will be receiving their own vaccine allocations. This is in addition to what the health department receives. Again, we will share more information as it becomes available. Another opportunity on the horizon is the third vaccine, Johnson & Johnson. They have asked for the Food and Drug Administration for an emergency use authorization for their single-dose COVID-19 vaccine. The FDA will hold the first meeting to discuss this vaccine on February 26th. If the company receives authorization for the vaccine, it expects to supply 100 million doses to the U.S. in the first half of this year. We are monitoring this closely and will share more information as it becomes available. Today, I also want to remind those who receive the COVID-19 vaccine that some side effects are normal and are signs that your body is building protection. The most common are sore arm, tiredness, headache, muscle ache, and chills. These symptoms should resolve within a few days. All those who are vaccinated do receive information about what to expect after getting a shot. And I want to remind those who have been vaccinated that there is also a smartphone-based tool from CDC called vSafe. vSafe uses text messaging and web surveys to check in with vaccine recipients following COVID-19 vaccination. vSafe will also remind them about receiving their second dose of vaccine, which will help provide the most protection. You can find vSafe at vsafe.cdc.gov. The first step to getting vaccinated is to register to receive the vaccination. Registration is open to all county residents, and we encourage all those who are in Phase 1B, those aged 65 and older, and those with underlying medical conditions to register soon. The health department will work with essential workers and their employers independently. The simple online registration is available at covid19.lincoln.ne.gov. Family members and caregivers are encouraged to assist those who need help to register. Those who do not have online access or who need assistance may call the COVID-19 hotline at 402-441-8006 to register. The form is available in English and Spanish. The health department also has interpreters available to assist callers who speak other languages. The simple electronic form captures basic information, and that will be used to help determine when the individual can be vaccinated. The information goes into a secure system and is strictly confidential. While the vaccine is not yet available for the general public, as doses become available, those who are registered will be contacted to schedule an appointment to get vaccinated. We encourage everyone to receive vaccine as soon as it is available to them. As we said before, the state has also launched a registration site. Again, Lancaster County residents only need to register once on either the health department website or the state website. The health department and the state health department can securely share data as needed. If you have signed up at both sites, it won't cause any issues, but it's not necessary. It's encouraging to see that every week the total number of Lancaster County residents who are vaccinated is higher than the week before. We will continue to keep you informed about the latest vaccination efforts, who is eligible for vaccine, and upcoming clinics as more vaccine supply becomes available. As the mayor discussed, the data we use to determine the position of our COVID risk dial has continued to improve over the past few weeks. We have seen improvement in new daily cases, local hospitalizations, the positivity rate, and other indicators For this reason, the risk dial has been moved from mid-orange to elevated yellow. This indicates more of a moderate risk of the spread of COVID-19. We have not been in yellow position since late August. In the past 5 weeks, we have seen the number of new weekly cases drop from 1,207 the week ending January 1st to just 425 the week ending February 6th. This is a drop of nearly 65%. We have now had 12 consecutive days with the number of new daily cases being under 100. The 7-day rolling average of new daily cases also shows a significant drop from 144 cases on July 22nd to 61 cases this past Saturday for that week. We also continue to see a decline in the number of COVID-19 patients hospitalized locally. We have gone from 116 patients on January 16th down to 45 this past weekend, more than a 60% decline. The 7-day rolling average for COVID-19 hospitalizations has also decreased for 20 consecutive days. Today, we are reporting 42 COVID-19 patients hospitalized locally, with 27 from Lancaster County and 15 from our surrounding communities. The next chart also shows the overall decline in new cases and hospitalizations. The orange line represents the 7-day rolling average of new cases, and the blue line represents the 7-day rolling average of our local hospitalizations. You can see that both have declined since early January. Unfortunately, we continue to report local deaths from COVID-19, but fortunately, we are seeing far fewer than we saw in December and early January. We are completing vaccinations for residents in long-term care facilities and have given first doses to many in our age 80 and over age population. We hope that as we continue to see lower COVID-19 hospitalizations and fewer related deaths as we continue to fight through this pandemic. Another important indicator that has dropped over the past few weeks is the positivity rate. In 5 weeks, it has dropped from a near all-time high of 32.7% down to 20.3% for the week ending February 6th. This is still high. We would like to see a rate lower than 15%, but the lower percentages are welcome, really a very welcome sign of improvement. This map shows how our local metrics are plotted to determine the position of the risk dial. The average testing turnaround time and contact tracing are both near green. Connected cases and ICU availability have moved into yellow, and the rest of the metrics have moved down from red farther down into the orange category. You will find the location of the risk dial now right on the border of orange and yellow, represented by the blue square outlined in red. This comparison chart shows what key indicators were on January 19th when we moved to orange compared to today, with our move to yellow on the dial. The 7-day rolling average of new daily cases is down from 135 to 61. The weekly case count was 953 when we moved down into orange. At the end of last week, we were at about 425 weekly cases. The 7-day rolling average of COVID-19 patients hospitalized locally was at 107 on January 9th. At the end of last week, we were down to just 45 patients. And finally, the weekly positivity rate has also dropped from 27.5% down to 20.4%. Seeing this progress is very encouraging, and the residents of this community deserve a big thank you for working with our health department to stay well and keep this virus from spreading. But we do move into yellow very cautiously. We need the public to understand that this progress can be lost more easily than it has been gained. The virus is unpredictable, and new variants may still increase its impact in Lincoln. We must not lose sight of the end goal of moving past this pandemic. To do that, we must continue to wear masks, stay at least 6 feet apart from those who are not in our household, and wash our hands frequently. We need the public to continue to engage in taking the steps to continue moving our community forward. Because of our progress that our community has made, we are making adjustments to the current directed health measure. The new directed health measure takes effect Friday, February 12th, and will be in effect through March 12th. Gatherings will be limited to no more than 75% of occupancy indoors and in confined outdoor spaces, with no limit on the total number of individuals. Events with more than 500 people must take place after event approval is received from the health department. The occupancy at restaurants, bars, and other food service establishments will be increased to 75% of occupancy. Parties will continue to be limited to 8 or fewer individuals and must remain at least 6 feet apart. Individuals no longer will have to remain seated. However, anytime individuals are not seated at their tables, they must be wearing a face covering unless they are also eating or drinking. Each youth sport participant may have 4 spectators, and a venue may seek approval from the health department to allow additional spectators if the venue can accommodate this increased capacity. Groups of youth sports spectators are still limited to 8 or fewer individuals, and groups must remain at least 6 feet apart. Concessions at youth sports events will now be allowed. Gym occupancy is increased to 75% of the occupancy. And also child care facilities will be allowed to otherwise resume normal operations, subject to heightened sanitation and COVID-19 mitigation efforts included in the directed health measure. In the weeks and months to come, it is important that we all stay vigilant. As we move forward, we continue to assess where we are as a community.
Thank you, Director Lopez, and thank you to Aging Partners Director Randy Jones for supporting our seniors. And at this time, I'd also like to thank everyone once again for tuning in and see if there are any questions we can answer. Any questions from the media?
Yeah, this is Brent with Channel 8. I have a couple questions for Director Lopez, please.
She'll be right here. Thank you.
Hi, Brent.
Hi, Director. We've been getting a lot of questions from people about the way the vaccines are being prioritized. For example, people asking why someone who is, say, 75 and healthy would be able to get it before someone who's 65 and has health issues. Can you kind of clarify or explain the prioritization process that the health department is using in selecting who gets to go to these clinics?
You know, the process we're using is the one that the governor has advised us to use. And I think even those individuals that might be younger than 75 and have health conditions, we do know that age is one of the biggest risk factors for having COVID. And after consulting with our physicians and others, we're following that. And that's no different than anything that's happening across our state. One department started at 90 and older based on their census. We started at 80 and over. And this week we're moving down to 75 and older, and we'll continue that movement.
And an unrelated question, but some school districts and some of the smaller kind of surrounding counties we know are receiving vaccine doses, and they plan to begin vaccinations early next month. Can you give an update as to where LPS and some of the other Lancaster County schools stand in regard to that, especially now that we're going to be getting more doses each week?
Well, you know, I think I just want to remind everyone that the governor has provided a directive that 90% of our vaccine go to those 65 and older and those with underlying health conditions. So that means 10% of our doses can move to the other closed areas, or we call them like closed pods, and for vaccination. So we're just finishing up adult protective services and child protective caseworkers now, and our next group are utilities, and then our mission staff, and then we'll be working with the school systems. And just to give you an idea, we have over 20,000 individuals from the school system that we need to vaccinate. And the schools have been working closely with us on identifying, of course, our educators and others at the school that we need to vaccinate. So we're a little ways off. And I also want to remind people that we've had a lot of interest in Lancaster County in receiving the vaccine, far more than some of my colleagues across the state have had in their health districts. So all those things make a difference for where we're at. And some of our schools, some of our districts maybe only have one school or two schools in a county. So we have to just remember there are multiple factors that go into this.
Director Lopez, this is Bill with 1011. Any update on if you have a timeline for winding down the mask mandate, or it's here to stay for the foreseeable future?
You know, at this time, until we actually get the vaccine rolled out and establish, get it well established in the community, and with the variants coming, we don't see a change in the mask mandate.
Director Lopez, Andrew Ozaki from KETV Omaha. I had a question about the federal pharmacy program and how closely you guys are working with pharmacies in the city. Do you know how many vaccines will be coming, what pharmacies will be available, and what criteria will the pharmacies be using in their waiting list?
What we've been told, Andrew, is that it'll be 65 and older. We don't know what doses. We've been told that it might be over 5,000 between all the pharmacies that are participating. We're still waiting for clarification. We were hoping to have that today. The state is hoping that they will learn more information tomorrow. But I can say in Lincoln, we've been working closely with several pharmacies. In fact, this week we mentioned that we have pharmacies carrying out the vaccinations in our senior independent living communities. So we'll continue that work, and once those pharmacies are identified, our intention is to continue close communication and work with them to make sure we can get the vaccine to those and continue to work through the process.
So will they be also doing, if a teacher wants to get a vaccination right now, do they call up the pharmacy? Will they be allowed in? Or I guess, how does all that stuff work? And will there be any coordination between what you guys do and what the pharmacies do?
Well, our intention is that we've been working with our pharmacies and that we'll continue that relationship. You know, as I said, what we've been told by the state is that the federal program is that the vaccine in our community and across the state will be for those 65 and older. But we're anxious to learn the details. The state's anxious to learn the details, and we'll keep you informed as we learn more.
Pat, this is Matt Olberding with the Journal-Star. I have a couple of follow-up questions for you. So Walmart announced today the locations that they're going to provide the vaccine, and they're all outside of Lincoln, Omaha, and Grand Island. They're all smaller cities. Are you aware of any other pharmacies that will do it in Lincoln or will offer it in Lincoln at this point?
You know, Matt, I'm working on confirmation of that. I was still trying to get that until 15 minutes before I came down here. And we have heard about Walmart and talking with the other health departments, and it's still not clear how that's working. And we also know that no vaccine has been allocated to any of these groups yet that are being identified. And you said we haven't, a Walmart in Lincoln hasn't been identified.
And then on the DHMs, have you had any? I know one of the big questions is attendance at youth sports and especially LPS games. Have you had any discussions? Has the school district approached you about possibly allowing more than just relatives of participants in, or have you had any of those discussions at all?
We actually have been having those since we changed the DHM last time. You know, we have 4 spectators, but the schools can work with us on a plan if they have the room in their gym for more, and we have approved some of those plans.
Okay, thanks.
Director Lopez, we have a question from KFOR. Are the pharmacies going to be able to provide vaccine to anyone, or will they have to abide by the same age groups that the public program is serving at any one time? Will the pharmacies be able to charge for it?
You know, I can't answer the question about charges. I've heard various information on that, so we've asked the state for clarification on that. And they can only, our understanding is they're being told that they have to vaccinate those 65 and older right now.
Director Lopez, how prepared are you to double, maybe even triple the amount of vaccinations you could administer?
We're prepared. We have plans. And you have to remember, for every dose we give, we're going to give a second dose. So right now, we're prepared for at least 10,000 doses a week, and we'll continue to move forward as we get more. We've looked at different resources. We have a strong commitment from both St. Elizabeth's and Bryan Health to assist us, as well as many of our primary care physicians' offices and staff in Lincoln. So we're prepared to move forward, and we have on reserve additional help if we need it.
Director Lopez, this is Bill again with 1011. Is it possible that the weather we've had over the last 2 to 3 weeks is a bit of a blessing in disguise when it comes to COVID-19?
Well, I didn't really look at it that way, Bill, to be honest with you. I was terrified last weekend, and I'm very worried this weekend about our people getting out. Maybe the weather is helpful. I do know, and you've probably seen, our flu numbers are way down in comparison as well. So that's a blessing that may be due to weather, but also due to people wearing their face coverings and watching social distancing. But I'll take your optimistic look about the COVID.
Pat, this is Matt Olbrand at the Journal-Star again. I had one more quick question. So there are basketball games, Nebraska basketball games this weekend at the arena. Are you guys having to do anything different or shorten the time period that you're doing the vaccinations to accommodate that?
Yeah, that's a great question, Matt. They are scheduling some, the Big Ten was scheduling, trying to get those games back in that were missed. And I have to tell you, the university athletic staff worked with us and the Big Ten and with Pinnacle, and we didn't have to make any adjustments. They prioritized the need to get our elders in our community vaccinated. So we're very grateful for the strong partnership we have with them.
And Director Lopez, after this weekend, how many more 75 and older group do you think we'll have in the city or in this county?
I can't answer that until we see how many we vaccinate this weekend, but we'll be able to give you an update next week. We were also following up. We had about 900 individuals that we wanted to follow up on to make sure they could get the vaccine. But our staff is also, we'll have our report from our independent livings as well, and then our second doses. So we're working on that, and I'll be able to give you a better update next week.
I guess I should rephrase that. If you got all of the vaccines administered, that you have available, where would you be in the process of vaccinating 75-year-olds and older?
Well, if we had them all vaccinated, the 75 and older, we'd start moving into the 70 and above. And we have about 6,300 individuals in that age group. And we're looking at some of the other ways to reach out into the community as well.
So I'm sorry, I still didn't ask that right. If you administered all the vaccines that you have available this weekend, where would you be in that 75 and older category?
We'd almost be completed with them. We have enough to vaccinate almost, except for about 800 of them that are registered. Remember, these are people that have reached out to us and we've added to the registration. So some individuals are getting them in the independent living communities or have gotten them through the VA or another resource.
One more quick follow-up on vaccination numbers, Pat, and I apologize if I missed this earlier. Is it 4,800 that's the goal just spread out between the 2 days at PBA?
Yes. Mm-hmm.
So do you know how many total this week Lancaster County hopes to give out?
Well, we have over 3,200 at independent livings, and then the 4,800, and we're completing another 500. So you have to remember that with the second doses and some of the doses held back by the pharmacy, for example, in the independent living program, one of our pharmacies had over 1,000 vaccines available that we combined with vaccine that we had for the age group and are giving them. Now, once these are all done, we're pretty close. Our goal every week is to get out every vaccine that we receive.
So it's fair to say then 3,200 for at least 8,000 first doses will be going out this week?
Yes, that's our goal.
And Director, how much should we put in the stock that, we've fallen behind in ranking as far as, the percentage per capita of doses to now 44th in the country? How much stock should we put in that?
Is that on the New York Times? That's where I've seen some of that. I look to our state, where we're at on that, and looking at across the country. And if you look at where some of those doses are and where our second doses are coming, it's a little bit different story. And I'm glad you asked that question, because the other thing is where the data is collected and provided to CDC is in an immunization registry system. And to access that system, a lot of that data has to be hand entered. The city's working on streamlining that whole process for us. So the vaccines aren't always automatically entered the same day they're given, but they are entered into the registry. We have a lot of questions about how that, some of the information and how it's being counted. It's not really clear to us. We go to the CDC and other sites and looking at how the vaccine's administered. I know in Alaska it looks a lot different, but the population in Alaska is tremendously different than us, and the vaccine that they're being allocated is different than us. So you have to take into all those things into consideration. And the only other thing I can tell you is that I talked to my colleagues across the state at health departments, and all of us are getting the doses in. So we can't ask for more.
This is Matt Olberding again. A quick follow-up for you. You said you had about 8,000 first doses this week. Would that be the most that you guys have done in 1 week so far?
Yes.
I have a quick question for Randy. If you want to come up, as long as we have you here, Randy, can you tell us about the success of NeighborLink and how someone can still participate? And also, if you see this as a program that will continue past the pandemic.
Oh, I'd love to talk about NeighborLink. NeighborLink program is a program that we started. Aging Partners and the Mayor's Office started this at the beginning of COVID as a way of partnering volunteers in the community to help seniors. And we've been so thrilled with the outcome and the success of this project that we've decided to continue it even post-COVID. Now, what we do is we accept volunteers who would like to be paired with a senior, and we're looking for long-term partnerships. We don't ask a lot. We want the senior and the partner to decide together how they can form that partnership. What are the needs of the senior that the volunteer can help with? Maybe in one case, it's going to the grocery store. In another case, I've seen some of our volunteers deliver flowers or potted plants to the seniors. Our own mayor was one of the first volunteers of the program, and she calls her partner once every once in a while to check on her and to talk about what's going on, just as a way of kind of providing some levity. So there's a lot of opportunities. We've had great success with the program, and I would encourage anyone who would like to either volunteer or be a partner to contact us. There's two ways. One is on the website, and that's aging.lincoln.ne.gov. And the other is by giving us a phone call at 402-441-7575.
Are there any further questions that we can answer today? Well, if not, let me thank you once again for joining us this afternoon to stay informed about how you can take care of yourself and your loved ones and your neighbors. And as we head into Valentine's Day weekend, a time when flowers and chocolates fly off the shelves in shows of affection, keep my friends' parents in mind when you consider what love really looks like. It isn't red, pink, sparkly, and fancy. More often, love is silver, pale, wrinkled, and simple. It's showing up over and over again for someone dear to your heart. Getting to yellow on the dial this week is proof that the people of Lincoln and Lancaster County keep showing up over and over again to take care of one another. It's a Valentine we've given ourselves. Our love and care for each other is what will see us through to the other side of this pandemic, to that day when more of us will once again be able to walk side by side and hold each other's hands. Thank you.